Welcome to the Lake Norman Chamber of Commerce Focus Friday. It's a special edition of our Focus Friday. This is going to be virtual, and we're going to focus on the COVID-19 coronavirus. This particular session is going to be facilitated by our Public Policy Chair, Jeff Tarte, who is the former North Carolina Senator, District 41, and a former mayor for the town of Cornelius. The Focus Friday is presented by Novant Health, and we thank our partners, WSIC, Business Today, and Cornelius Today. Jeff, if you'll go ahead and introduce our panel today, and the floor is yours.
All right, thank you, Bill. Appreciate everybody joining us this morning. For those listening in and those that are able to watch us, first person that's going to be speaking today, and we've got some questions for, is Dena Diorio. Dena is the Mecklenburg County Manager, and as I always describe her, a true rock star. We are blessed to have her leading our county government. Dena, it's a pleasure to have you here this morning.
Thanks for having me. I appreciate it.
Next person that we're going to follow up with is going to be Mike Riley. Mike is uniquely qualified to help us address some of the healthcare issues today because he is the CEO of Novant's Huntersville Hospital, but he also is an RN. So he's got a medical training background as well as running a large hospital. And Mike, again, we appreciate you as well being here.
Glad to be here.
And then next we have Eileen Joyce. Eileen is going to be one very busy lady over the next few months, as well as the other folks on this panel. But Eileen is one of the lead economic development specialists with this Small Business Administration. So the SBA has enacted a disaster assistance program along with their regular business loan programs, and we'll be picking her brain and getting more guidance from her later this morning. Eileen, appreciate you being here.
Pleasure to be here.
And then anchoring our four-man bowling team today will be Kenny Colbert. Kenny is the CEO of the Employers Association. He has the distinct honor of representing over 900 employers in the Mecklenburg, Charlotte metropolitan region. Kenny is a true business expert. He'll be able to help us address some of the new legislation and laws that have been passed, both at the federal and state level, as well as help us understand some of the HR issues and some of the issues the businesses are going through right now. Kenny, it's a pleasure to have you here.
Good morning.
All right, so let's just jump into it. Dena, I'm going to put you on first, and if you'd be so kind, maybe share a little bit, let us know and understand how the county's addressing the COVID virus pandemic.
So as you probably know by now, local public health departments are, incident commanders for COVID-19 response in all the counties in North Carolina. So my public health director, Gibby Harris, is the incident commander, and we have been taking an incredibly aggressive approach to try to stop the spread of COVID-19 in our county. And I believe we have been the lead in the state in terms of putting together a response. We were the first to do a health order that closed restaurants and bars, health clubs, gyms. We were the first to put out a stay-at-home order. And we're seeing that there are many counties and municipalities across the state that are following our lead. And so, we believe that the more aggressive we are in the front end, the better we'll be on the back end. So we feel good about our aggressive approach, and we think it'll pay dividends in the end.
Yeah, do you mind kind of sharing for us in the audience to understand what goes into the decision process to put in place a stay-at-home order, and who was involved and what was factored and considered?
Sure. Well, we have a call every morning with the two hospital CEOs, Gene Woods and Carl Amato. We have
that's from Atrium and Novant.
It is. And we talk to our emergency management folks. We talk to the emergency management folks at the state level. We talk to our towns to see what the situation is on the ground there. And we really, for some number of days, we're really talking about a couple things. One is the concern about the number of cases that we're continuing to spike, and we continue to see that. We've got some new numbers this morning that, again, indicate that we've got a significant amount of spread here. We were also talking to the hospitals about their capacity and their ability to be able to manage medical surge. And so really taking all of those things into consideration is what led us to go forward with the stay-at-home order.
Okay. Great, appreciate it. A little bit, can you tell us then, how will the stay-at-home order be enforced? I mean, I've already heard rumors of a police officer stopping somebody, asking them, and trying to determine whether they're an essential business, and we'll talk a little bit more about that in a second.
So there's a provision in the proclamation that violation of the order is a Class 2 misdemeanor. CMPD, which is a Charlotte Mecklenburg Police Department, is working closely with the town police departments as well as the sheriff to make sure that we have a consistent approach to enforcement. And so the primary way they will enforce is through conversation, dialogue, and education. While you may have heard that somebody was stopped on the street, that is not part of the enforcement protocol. So we need to investigate that a little bit further.
A little aggressiveness there maybe. Because
Yeah.
the question is, I know people are wondering, you know, are there going to be penalties and stuff? As you said, it's a Class 2 misdemeanor, which depending on whether you have prior involvement with law enforcement, I mean, that can be up to a 2-month jail sentence and a $1,000 fine. So it's nothing to be taken lightly. So just curious, has there been a message that, you know, this is more of a warning, more of a let's encourage people to stay off, or are we really, do you see tickets being issued at some point?
You know, the police jurisdictions are not going to lead with that. I mean, I think the whole point is to try to get people to comply voluntarily, and we want to do that through conversation and dialogue. But I suspect that if people really push back and don't comply with law enforcement's direction, then I can see people being arrested and penalties assessed. I mean, this is about public health, and it's really important.
Yeah, it makes sense. Kind of jumping into the great big one right now that I'm getting lots of questions on relative to being in the public policy chair seat for the Lake Norman Chamber is around the whole essential businesses. Maybe if you can just give, and I know that talk about where that list is, maybe share a little bit about it. And then the corollary question is, if you're not, or somebody comes and said, I'm not on that list, I'm not determined as an essential business, how do I get designated as one?
So the list of essential businesses was taken directly from the guidance that we received from the Department of Homeland Security. And so we use that almost verbatim. One of the things that we added that was not in the Department of Homeland Security guidance was hotels and motels. Under their guidance, they're non-essential. In our guidance, they are essential. And so we really use that. And we're continuing to evaluate it and to make sure that, you know, we understand the impact that we're having. We continue to interpret it. We're continuing to provide additional guidance around how that should be interpreted. If you are non-essential, there's no process for you to try to make the argument that you are essential. We're taking a very, very strict view because, again, we want to make sure that we keep as many people home as possible.
And again, who actually determines and sets that list? I've heard it is the emergency management department at the state level, county level. Is that the entity that's making those determinations, or someone else?
It is emergency management in conjunction with public health and the county that are really making those interpretations.
Okay, now and dropping back to the stay-at-home order a little bit. Right now, it's set for 3 weeks. Is that correct?
Yes.
And what is that date that it's to be?
It'll be midnight on April 16th. It's set to expire.
Midnight on April 16th. What's going to factor into the decision, and who will be involved to determine whether that's the end of the stay-at-home order or whether it would be extended?
So that would be a decision that would be made jointly, again, by the county, public health, the city manager, the town managers, emergency management in conjunction with the 2 hospital systems. And what we'd be looking at is the number of cases we see, if the number is increasing, or if we see the rate of increase start to slow. Those are some of the considerations that we would look at, as well as hospital capacity. That would be another big condition about whether or not we would be able to let the order cease or whether we would need to extend it.
All right. A couple interesting things. And neither one of these fall under your jurisdiction, but it's a common question, and I don't know if there's an answer to it directly, is because things like the ABC stores are open, and yet the sheriff's office is closed. And can you explain or help us understand, if you know, and town halls are closed, as I understand, but that doesn't mean they're not functioning and operating. I want people to not be confused by the physical offices closed, but does that mean all the county sheriffs went home and they're following the stay-at-home order themselves?
Well, first of all, like as it relates to sort of the ABC stores, they're under state jurisdiction, so we don't have the ability to force them to close. So at this point, they're still open. I will tell you that Mecklenburg County, we are probably 80% virtual now, and we are providing all the services that we normally would. And so we've been very fortunate, as I think all the towns are, as well as the city, to make sure all of our services are available to the extent that we can provide them virtually. And we've been very successful at doing that. So I would say, Mecklenburg County is open for business, and we are here to serve the people if they need us.
Super. Any last comments or thoughts you want to share with the folks that are listening in and watching?
So I just, first of all, want to appreciate everybody's patience as we work through this. I know the business community has concerns about the stay-at-home order. We understand that. But what we would encourage is that people find ways to comply, not find ways to get out from under the order, because we believe the higher level of voluntary compliance we have, the quicker we get through it. And so we have the helpline, 704-353-1926. Please call if you have questions, because those questions help us understand where we may need to make adjustments in terms of how we implement the order. So please continue to call and give us the feedback, because it's been incredibly helpful for us.
And if you would be so kind to maybe repeat that number one more time, and we'll slow it down just there so I can write it down and everybody else can as well.
704-353-1926.
Wonderful. Thank you.
You're welcome.
All right, Dena, I appreciate you being here this morning. If you can hang out with us, it'd be great. And if there's something that you hear you can interject in, please feel free to jump in. But
okay, I'll hang out for a bit.
Thank you for being here. Mike Riley.
Hello.
Good morning, sir.
Morning.
It's a pleasure to have you here. As always, good to see you. We tend to cross paths quite a bit, a number of activities that we're both jointly engaged in. And I know you are one busy man running a hospital during this process. Can you share with us a little bit how hospitals specifically and care providers are dealing with the coronavirus?
Sure. And, where we are right now in the Charlotte area is we are at the very, very beginning. I looked up at the NCDHHS site, and I would encourage others to do that too. That's really a good source of truth for where things are with the numbers. And I think when I looked at it this morning, there were 181 positive cases of corona in Mecklenburg County. And it's a really neat site. You can look on the map and you can see all the counties and how many positive cases there are. So we're at the very beginning. 181 cases for our county is it's not good, but it's a very, very low number, and it's only, and it will only grow. I think, one of the things I want to plug just before we even start really talking is that there's been some controversy about the stay-at-home order and is it really necessary and those kind of things. And I would tell you, yes. I think right now where we are, again, very small number, but the degree to which and the speed with which that number grows is really going to be dependent on how compliant the community is with the stay-at-home order. So I just saying that. But to get back to your question, Jeff, with the hospitals, we're doing fine now. All hospitals have at 24/7, 365, we have an emergency management plan. So we're ready for mass casualties, we're ready for natural disasters, we're ready for anything that comes. So what we've been doing over the last months, really weeks and months, is taking those disaster management plans out and really tailoring them to what we've seen in China, what we've seen in Italy, and what we're starting to see in New York. And so we're planning for Italy. We're assuming that Italy is going to come. We're hoping that it doesn't, but we're planning for the worst. And so there are a number of things that we've done. We've really, the state of North Carolina lifted or allowed us to increase our number of beds significantly should we get to the point where we have a huge insurgence of patients. So we've been looking at every place in the hospital where we could safely put a patient, to everything from using our recovery rooms for ICUs to a lot of other things to figure out where we could add patients.
I know and it's obviously a very pragmatic approach. There's the classic plan for the worst and hope for the best. do you guys anticipate you're really going to need, float beds and temporary facilities and that sort of thing? Do you see it getting to that level or potentially getting to that level?
Yeah, it's really hard to say. I'll tell you right now, and I'll speak to Huntersville, but really, same is the case for a lot of different cities around the country who have not been hit yet. Our volumes are low. The last place you want to come right now, unless you're really sick, is the hospital. So people are staying away. You've probably heard that we've delayed or canceled our elective procedures, whether that be surgeries or various other things that we do that could be put off. We've done that. So our volumes are low right now. So your question, it's impossible for me to say. Yep. We could turn into New York in a week or two, or we could be okay. And again, I really believe that it's going to be based on how well the community adheres to the stay at home.
You brought up a point, so let's kind of go that direction a little bit. First of all, let's start with, how do people tell, and now I'm going to let you put on your health background and your nursing degree. How do people determine whether they've got the flu or COVID?
Outside of testing, you can't. The symptoms for corona and the symptoms for flu are very, very similar. One of the ways that we actually rule out coronavirus for patients who are sick enough to be in the hospital is by testing them for the flu. And if they test positive, there's a very, very, very low likelihood that they have corona because the symptoms are so similar.
Is the flu test a more accurate test than the COVID test or not?
I can't speak to accuracy, but I know it's a much quicker test right now. We can get the flu results in an hour or so.
Wow.
And the COVID test is taking anywhere from 24 hours to 7 days. And the good news with that is that's also speeding up, but it's been on average 4 to 7 days until just recently.
So the COVID test is a swab up the nasal cavity. Is that correct?
Yes.
And how do you take tests for flu?
Oh my gosh, you would ask me that. I've been out of practice a little too long. I'm not sure
Okay.
I'm not sure how the flu test is done. Whether that's a blood test or it's a swab, I'm not positive.
Well, I could just yell out the door and ask my wife. She's a pediatrician, but we will not.
She would know.
Well, she's been testing for it. So then on the test, following that train of thought a little bit, when do you determine as an individual that I should approach a healthcare provider to be tested? When should I be thinking about having that done?
So if you're having symptoms, the cough, the fever, shortness of breath, those kind of things, you should call your primary care. Don't run. One of the things we're asking people is don't run to the hospital and inundate the hospital because you're sick. You would call your primary care. And they'll ask you a number of screening questions about where you've been, what you've been exposed to, what your symptoms look like, do you have a temperature, and then they'll determine if you should have the test or not. Novant has a number, it's 1-877-9-NOVANT. So if you have any questions about whether you need to be tested or not, they will either hook you up with a primary care or they'll screen you there. We also have a site I think Novant has 5 or 6 sites throughout the footprint, but up here in Huntersville, there's a site at Hollycrest. It's at 16525 Hollycrest Lane at exit 25. That's a testing site, right? It's
dedicated just for testing.
Right. It's one of those drive up testing sites. And important with that, it's not, if you look good and feel good, we're probably not going to test you. We're going to screen you and say, you know what, you really don't need to be tested, because at this point, we don't want to clog up the system with a bunch of, people who don't need to be tested.
You give milkshakes with that test? If you can do one quick favor for me, and again, like we did with Dena, would you repeat that contact phone number and do it a little slower so people can write it down that have an interest in doing so?
I will. It's 1-877-9-NOVANT, N-O-V-A-N-T.
Hey, great. Appreciate it. A couple other quick questions for you. Put you on the spot. We're all doing the social distancing, or we hear about it. We hear about again, like I said, I hear my mom's voice ringing in my head all the time. Go wash your hands, go wash your hands. Is how much of an impact do both of those activities really have? Is it helpful, as they say? Or you see on social media people kind of saying, no, that's goofy, you don't need to worry about it.
No, and those people on social media that say it's goofy is the reason this thing is spreading so fast. There are a few things that it's hugely important that you do. One is wash your hands. Two is social distancing. Adhere to the home order. Stay informed as much as possible and stay calm. I think what the way that this is transmitted, it's from person to person who have close contact. So if you're within 6 feet of a person for more than 5 or 10 minutes who's positive, there's a really good chance you're going to get it too. If you touch something within a short period of time go to the CDC website for the period of time, because I'm going to get that wrong too. But if you touch a surface that someone else who's been infected touches, and then you touch your face or your mouth or some kind of mucous membrane, then you could be infected. So yeah, it is 100% true that contact and hand wash and minimizing contact and hand washing are the two things to do to really keep this from spreading.
So are you familiar with the concept that's floating around of flatten the curve?
Yeah, I am. And I think that's the reason we're doing what we're doing with the reason the city and the county is doing what they're doing with the stay-at-home order. It's one of those things where you think about the flu. This is a little more contagious than the flu, but you think about how that spreads every year, and this is a little more severe and a little more contagious than the flu. I think people will, at some point, will get to the point where this is kind of a common, almost like the flu that we get every year. But the problem with this is there's no vaccine for it. There's nothing right now that's doing anything we're just treating symptoms. We're not really treating the virus itself. So the flattening the curve is keeping people, having the disease spread as slowly as possible. Because if we just went and ignored it, I think Italy is a great example. You hear about what's happened in Italy. They've essentially ignored it until it was too late, and so that their hospitals got inundated. Everybody got sick. I can't remember the percentages, but huge percentages of people were in hospitals, and that's what we're trying to avoid. I think people will get sick. I think people will get this, and I think 80% of people it'll be relatively mild, but for 20% of people it's severe.
Any insight you can share, and you may have some or not, what's the status of, because I know various organizations, pharmaceutical folks and labs are trying to develop vaccine. Any word on the status of that? And secondarily, do we know anything about this particular strain of coronavirus, the COVID-19, whether it will react like a lot of influenza strains, that once you've had it, you develop immunity to it, and after you've had it, you don't have to worry about it, kind of like smallpox or whatever.
Yeah. So as far as the whether or not we'll become immune, yes, I think it will be like that. I think over time, over years, there'll be what they call herd immunity, herd H-E-R-D. Is that how you spell herd? Like with animals? Yeah. Herd immunity, which means people will get it, and just because the human body naturally develops antibodies to things that will become more immune to it. One of the flu is a good example. We're not really immune to the flu because the flu every year tends to mutate, and so you would think, why don't we keep getting the flu? Well, the flu virus mutates every year, and it's a little different, so more people get it. And I'm far from a scientist, so I can't give you a really educated answer about a vaccine, but usually vaccines take a year or 2 or 3 to really develop a good vaccine. I know that there's a lot of work being done on that, so hopefully that'll be done much faster, but not any good information on that right now.
Good. Two last things that I wanted to run by you. One is, because we're hearing, and it really pertains to different parts of the country, New York, California, some of the others, but do you have a sense, or can you share how supplies and ventilators and access to and the numbers and availability are in the kind of Charlotte region right now? And is there anything that the community, the business community in a sense, can do to help in that regard if there is a need?
So that's, this is one of the things that has been so just inspiring during this whole process. I can't tell you how many people have called me, texted me, emailed me to offer support, whether that be, great job, emotional support, we're here for you, or we've had people who've dropped off masks, and we've got companies who are, Lowe's donated, I think, 30,000 masks to us. That we're just seeing a huge outpouring of support from the community, which has been fantastic. So I just had to mention that. I'm just so thankful for that. As far as PPE, right now we're fine. We're using significantly more than we usually do just because for an abundance of caution. And we have great supply chain folks who are evaluating all kinds of different places to get it. But like all healthcare systems across the country, we're bracing for shortages. You hear about what's happening in New York and other places. If you watch the news at any time, you can see that that the concern's isn't unique to Charlotte or Novant or any one hospital. So they're valid concerns and potentially frustrations. So am I worried? Yes. Are we fine right now? Yes. And it all depends. You talked about flattening the curve. It really depends on how well we flatten the curve. If we have to double and triple the number of patients we ordinarily see, it worries me. If we see a 20 or 30% increase, we can handle that. So I think it just really depends on how well we do with flattening the curve.
So stay home and wash your hands.
There you go. That's my message. Yes.
one quick one, again, because you brought it up, there's a point before the last point I want to raise, is you mentioned mask. Is there any guidance? Because people, you've seen videos and news footages of people wearing masks, surgical masks versus the N95, which is a more robust mask. You've seen people in painter type of devices. What's the guidance or your thoughts on when people need to wear a mask, don't need to wear a mask?
So with that, I want to refer everybody to the CDC website because it changes it's been changing so frequently because this is such a new virus. Right now, what the CDC is saying is that for aerosolized procedures, meaning things where there's going to be positive pressure, aerosolized, a good example is during an intubation or if you a nebulizer treatment, those kind of things. The recommendation is an N95 mask. But for just regular contact with positive COVID patients, it's kind of standard PPE, a standard surgical mask with goggles of some sort, some kind of eye protection, and a plastic gown.
Gotcha. Appreciate it. One last question. This is more of the old Inquirer magazine, it feels like sometimes.
No comment.
Inquiring minds want to know. Do you have any insight to, or are you familiar with because people are looking at it as a way to treat COVID-19, is the hydroxychloroquine?
Yeah.
And what's your thoughts around that? Or is it like too early to know?
It's way too early to know. And I don't, it's one of those things where it may have worked on one person at one point. And it's just way too early for me to say this is going to be a great thing or not. I imagine, like all antivirals, it'll help a little bit, but it's certainly not going to be a cure-all.
All right. Mike, as always, anytime I'm around you, I learn stuff. You are an amazing resource of knowledge on the healthcare front. So again, we appreciate you taking the time this morning to join us.
Thank you.
All right, Eileen. Joyce is with us also. She's from the Small Business Administration. Eileen, thank you for being here this morning.
Thank you.
I know all of you guys are just running in 18 different directions with all that's going on. Would you be so kind to maybe take a few minutes and tell us what we need to know, the business owners particularly, and employers, what they need to know in regards to what the SBA is doing right now?
Well, up until yesterday, we were just working on the economic injury disaster loans, the EIDL loans, which are direct loans from SBA.
And what is EIDL?
Economic Injury disaster loan.
Gotcha. Thanks.
Okay, that's what SBA offers, and we still offer those loans. The system basically crashed due to the sheer volume of people trying to upload information. I believe Bill has some slides that I can show, so I can show you what the website looks like.
Great.
And so if those can pop up, that would be awesome. I could explain it.
We're working on it.
There we go. So that's the hyperlink to the disaster loan application, disasterloan.sba.gov/ELA. Prior to yesterday, if you went to this site, you would actually upload all of your information into the portal. Well, now when you click on apply loans, that is now going to be uploading your information to a Dropbox. So if you flip to the next slide, that's what you're going to see. And this is just a screenshot of the first half of this web page. And there's the instructions to apply. There's all the forms that you need to download. I've been recommending to all the business owners I've talked to is to print out all of these documents, because it's gonna take some time to fill them out, and just having them, printing them out, getting the information you need, filling them out online, saving them, naming them properly, put your name on them with the application name. And that'll help put yourself in the shoes of the SBA loan processor who's going to be getting these. Make it a little easier for them to process your loan. Get everything in there like you need. There's a couple of things that are pretty crucial when you're filling out your application. There's a form that requires you to list your monthly sales. It's very important that those sales match your tax returns. SBA is going to require you to sign a document so that we can get a transcript from the IRS to make sure that you, one, have been paying your taxes and that it matches what you're asking for. Nowhere on the SBA application does it ask how much you want. SBA determines that based on your expenses and your sales and your payroll, and that's how that's derived.
So Eileen, the amount
Yes.
that you're eligible to receive is going to be adjusted and determined based on, in a sense, your revenue and profits then?
Correct.
Okay.
Basically your expenses. What's your working capital need for the next 6 months?
To stay open and operational.
Correct.
Okay, good to
And
know.
that was as of a day ago. Well, Congress has passed the CARE Act, and we have not received a lot of detail about that. I've been able to look at some different websites that have listed a lot of the different federal agencies that are going to be involved. The payroll, what's it called? The payroll protection program, the Paycheck Protection Program, is actually going to be a bank loan. It's not going to be a direct
A
loan
loan is
from
the
SBA.
operative word in that, correct?
Pardon?
Loan is the operative word.
Correct. However, in the Paycheck Protection Program, the payroll part of that could be reverted to a grant.
Mm. How does that,
That is brand new.
happen?
Pardon?
Do you know how does the reversion from a loan to a grant occur? Is there something action that must be taken by the employer or employee, or is that something that happens automatically behind the scenes?
That's a really good question. And because this is a bank loan, the banks are going to be looking to SBA to provide this guidance. And we've never had anything like this before.
Mm.
So this is all going to be a work in process. It's a very intriguing program, but I did read that you cannot have an economic injury disaster loan at the same time you've got a a paycheck protection program. So there's two.
One or the other.
Right.
How does the determine who qualifies for each?
Well, you must be a business owner for at least a year for the EIDL. It's not for startups.
Okay.
In the Paycheck Protection Program, you can be a little younger business owner, like starting your business in January. They are looking at that. But again, those are bank loans. And this is the EIDL is a SBA disaster loan. So it's important for business owners to read the information about EIDL, read the information about paycheck protection. I would not call your banker at this time because the bank, I checked a couple of bank websites and none of them have anything on that yet.
Okay.
I'm sure the loan officers are waiting for guidance from SBA to provide that. So just hold tight for a little while.
And the banks, there are some banks that have preferred status with the SBA, is that can approve the loan directly themselves, and some that have to go back the loan application directly to you. Is that correct?
That's correct. Most of our lenders on this side of the county are preferred lenders.
Okay.
So it won't be a problem. We have some very good lenders in North Carolina that are very active in SBA lending.
Great. And is there a size limit? Can it be a single person employee of their own business, one person? And is there a size on how big a company can be?
I believe you can have up to 500 employees, but sole proprietors are eligible to apply.
Okay, good. And one thing I know, from the time somebody pulls down the website, prints off the forms, completes them, sends them in, you have any sense of a time frame from the time I apply to when I actually would see funds? And then how are funds dispersed?
Well, I'll start with the last question. The funds are dispersed electronically, and we have no idea how long this is going to take. In a normal situation, if it's an isolated disaster like a hurricane or a tornado, it's usually 2 weeks. But we have every business owner in the country is applying for this loan. I do know they're expediting an initial payment, but if you're looking for a loan over $25,000, or if you qualify for more than $25,000, that will take a little time.
So with that said, as this unfolds, one of the things that I'm hearing for a few people who've already started working with the forms, that they're kind of complex. It's not just necessarily totally intuitive. Any suggestions on how or where individuals that might have trouble completing an application, where they could go for help?
Exactly. We have resource partners in Mecklenburg County, and I've listed a couple right here. The SBTDC, the Small Business and Technology Development Center, has an office at UNC Charlotte, and they're all working remotely too. But they've developed a web page specifically for coronavirus, and actually have a PowerPoint out there to help people with the EIDL application. There's also an additional loan program from the Rural Center, the North Carolina Rural Center.
Just heard about that, yeah.
Yeah, and you can find information about that program there. The folks at the SPTDC can help people with the application. The more complicated your business, the more complicated the application and what needs to be secured with the loan. For example, if you're looking for $300,000 or $400,000, SBA is going to want to look for collateral. And if it's equity in your business or equity in your home, well, then deeds of trust are involved. So not to get into the weeds with that, it's just keep in mind, the bigger the loan, the more complicated.
And the collateral typically has to be physical assets rather than, can you factor AR, or do they factor outstanding customer contracts? Does that get considered or not? Do you know?
I do not know, but most of what I've heard is it's usually property.
Yeah, a building, an automobile, a house,
right?
Sort of thing.
We also have a women's business center in Charlotte. It's located on the north side of the county. those ladies are working from home too, but they are helping folks. They work a lot with the smaller women business owners, and they are working with their clients and new clients to maneuver the disaster website. We'll be talking with all of our partners later today and next week about the new Paycheck Protection Program.
Sure.
And see how we're all going to be working with that. And of course, Central Piedmont's Small Business Center, their counselors are doing the exact same thing. We're all in this together. We're all trying to help people maneuver this and to get their money as fast as they can.
This is kind of an obtuse question, but do you know of, or is either, first of all, any special assistance programs and or, I don't want to say favorable, but or going to the head of the line type of things, but ways to give them added help for minority businesses or DBEs or that sort of thing?
Not in our program. It's when you're in line, you're in line.
Just in line. All right.
Mm-hmm.
Well, Eileen, you're a wealth of information, and I've been on the SBA site, and there is so much information out there to follow that can be helpful for our businesses. Any last thoughts or guidance you would like to leave with us?
Oh, have patience. We're all in this together, and we're all human, and we've got a lot of computer issues because it's so overwhelming, but we're working really hard to make the application easier, the process easier, and we want to get this money out as fast as we can.
And Eileen, you actually live in North Mecklenburg, don't you?
I live in Cornelius.
All right, so we're going to give your address out now. No, I'm kidding. For special help. Anyway.
Line up at the front door, 6 feet apart.
There you go. Practice good social distancing. I like it. Well, again, wealth of knowledge. Thank you for joining us this morning.
Thanks for having me.
Indeed. Kenny Colbert is with us. Kenny, thanks for joining us. Kenny
Can you hear me?
is responsible CEO for the Employers Association, which, as I mentioned at the beginning, represents over 900 businesses in the whole metropolitan area. I mean, you've got a very important job. Maybe start out first. What's your members bringing to you? What's their big concerns? What's their big issues? Where do they need help?
That's the number one phone call and email that we're getting is related to either unemployment, layoffs, or short work weeks. They're the primary concerns of our member companies.
And recommendations, guidance around that? What's the conversation?
Yeah, and just to show you the volume, we're getting probably 20 phone calls a day and 50 plus emails per day related to these subjects here. And really just how to do it. A classic case on layoffs. Some companies are just having to lay off selected people. So their questions are, how do I select these people and not run afoul of laws related to age and race and sex and religion discrimination? So we're having to help companies walk through Title VII of the Civil Rights Act of 1964, in addition to helping them run their business.
Any 60-second guidance on that very point, how to avoid getting sideways?
Well, we tell people to set up a grid. So let me give you an example. Let's say you've got 10 widget makers and you need to eliminate 5 jobs. In a vertical manner, put all 10 names on there, and then in a horizontal manner, set up some criteria, such things as attendance and productivity and number of jobs that you're qualified to operate, et cetera. And you rate all 10 of these widget makers, and the bottom 5 are the ones that lose their job. So you're making these decisions based upon quantitative matters, and that will generally always hold up.
Another issue that I've got employers asking me is, and maybe you can, I don't know if you're experiencing it or it's a common question or not, but people who have full-time employees that are thinking of shifting them to hourly, their ability to do that without, violating some law, their ability then, because I know how they can prevent people, minimize or cap their hours worked so they're not running up big overtime hours, or ensure when they need to pay overtime. Any of that
Sure.
you're experiencing or you can help us with?
Oh yeah, that's a very common phone call that we're having right now. People are trying to reduce their payroll. So a common question is we want to, give a 10% across the board pay cut. Can we do that? And the answer is yes. Or we want to take our exempt employees and make them non-exempt employees and only pay them for the hours they actually work rather than having to pay them for a full week. And the answer is yes, you can do that. North Carolina has a law that says that if you're going to change somebody's rate of pay or method of payment, you tell them in writing in advance. And interestingly, that's only 1 day in advance. But we tell people to try to give a little more notice from that so there won't be paycheck culture shock. But lots of questions. And as long as you're doing it for a business reason and not an age, race, sex, religion type reason, you're going to be okay to do it.
Can you help us a little bit then? Because these are the layoff questions. This is really interesting and it impacts so many people. Can I suspend somebody versus terminating them or laying them off? If I lay them off, people are asking, what do they do with paid time off earned? Can employees use that as part of the suspension time so they can be compensated? Do employers, can they suspend paying PTO, or does it have to be paid if it's taken? And is earned, is that a liability that if they terminate somebody has to be paid out, or does that depend on how the employment contract is written? Do you have any insight?
Well, let's look at two things. If it's going to be a permanent layoff, so you're separating the person from the payroll because of poor business conditions, et cetera, this is back to a North Carolina law. It says that all accrued vacation time, sick time, PTO time, whatever you happen to call it, has to be paid out to the employee unless you have a well-crafted forfeiture policy. So if you have a written forfeiture policy, you don't have to pay it out. If you do have if you don't have a policy, you have to pay it out. If you do have a policy, you may be able to get around that.
But
For
you can't. Excuse me, Ken. I didn't mean to interrupt. Go ahead.
So here's a classic example. A lot of companies have a rule that says if you offer to work a 2-week notice when you resign, we will pay out your vacation. If you don't offer to work a 2-week notice, we don't pay it out. That's a well-crafted forfeiture policy. Here's one that we recommend for companies is if you are involuntarily separated for any reason other than lack of work, we will not pay it out. So bottom line is if I fire you for being a poor performer, sleeping on the job, sexual harassment, you don't get it. But if I eliminate your job, you do get it. So again, the key is a well-crafted forfeiture policy. Now for temporary layoffs, let's say somebody's going to be out of work for a couple of weeks. What some companies are doing is saying, hey, if you want to get paid, you can use your PTO time, et cetera, that you've built up. If not, you may want to sign up for unemployment during that period of time. You cannot draw unemployment and PTO payout at the same time, though.
Okay. Question, do you know, or any guidance on how far in advance should that policy, that well-written, crafted policy be in place that it's effective? I assume I could not write it today and then have it apply tomorrow to employees. Is that fair?
We tell people to do it is at the end of your vacation or PTO year or something like that. So a lot of companies will write these policies, say in maybe November or so, to get ready for January 1st when people get new PTO allotments in their bank.
Gotcha. How's the stay-at-home order impacting businesses right now? Is it enough people can function from virtual because everybody's shifting to that, and which companies are like going to struggle because they need to be at customer sites or have customers physically present? Any?
Yeah. This has been a big issue, and I think one of the challenges is at-home equipment. You've got a lot of people who can do their job from home, but they may not have like computers and monitors, et cetera, that are set up for business purposes. It may be more for personal usage. So a lot of companies have been scrambling to round up some laptops and extra large monitors or double monitors, et cetera, to have their employees working from home. So a lot of people have kind of gotten caught off guard with this.
I guess there's
the other thing.
Go ahead.
The other thing a lot of companies are having to do is, you know, for these at-home workers, some people do it on a regular basis and they're used to it, but a lot of people just have never worked from home. And let's face it, some people are good at-home workers and some people are not good at-home workers.
I'm a great at-home worker. I watch Oprah and eat Oreo cookies. It's a great way to function every day. The couple things that if you can get in and help us, educate us. One, there's been some changes to the North Carolina employment security law, and it's come out through an executive order of Governor Cooper. Can you educate us a little bit about that?
Sure. Governor Cooper signed an order a couple of weeks ago, and there are several main parts to it, but I'll focus on three of them. Number one, the waiting period to draw benefits has been eliminated. Typically in North Carolina and most states, there's like a 7-day waiting period. So the first week you're out of work, you don't draw. Subsequent weeks you do. That 1 week waiting period has been eliminated. Here's a big issue that's changed. If you're drawing unemployment, you do not have to look for work while you're out. The thought being that maybe this is going to be a temporary deal. People draw a few weeks of unemployment. When this blows over, they come back to their original employer. And then from the employer standpoint, here's a big change is benefits because of layoffs due to COVID-19 are not going to be charged back to the employer. So it's benefits non-charging. Just to give a little bit of history, because this is going to be a very interesting subject over the next couple of weeks. Let me kind of walk you backwards on this a little bit.
Okay.
Back in 2008 and 9, North Carolina had about a $1 billion surplus in their unemployment fund. During the recession, they blew all of that money away, giving it to employees. And in essence, they had to borrow $2 billion, that's billion dollars from the federal government to pay all of the unemployment claims.
They borrowed that from Bill.
Yeah. So in 2013, the North Carolina legislature made some changes. They increased payroll taxes for employers and they reduced benefits to recipients. As a result of that, we now have about a $3.8 billion surplus in the reserve fund. But at the rate we're going right now, that's about a 3-month reserve. So get this, in the last 7 days, 180,000 people in North Carolina have signed up for unemployment. In a typical week, about 3,000 people sign up. So 180,000 people have signed up in the last 7 days on this. Now, here's where it's going to be an interesting battle that you're going to hear about in the coming days. The stimulus package that I guess will be passed today, one of the provisions, unless it's changed, is all unemployed people will receive $600 per week in federal unemployment benefits for a 4-month period. And that's on top of what you're getting from the state benefits. So let me give you an example. Let's say you've got—
Do you know the state benefit level, Kenny, offhand?
Yeah, it ranges from $15 a week to $350 a week. It used to be a maximum of $535 a week, and in 2013, that was cut back to $350
And what's the duration? Do you know how many weeks max you can draw on the state level?
12 weeks.
12 weeks.
12 weeks is the max. It was 26 weeks, and it was cut down to 12 weeks. And quite honestly, this has not even been an issue in the last few years because we've had very few layoffs, et cetera.
Sure.
But here's an example that a lot of people are going to be talking about in the coming days. Let's say you have an employee who makes $20 an hour. He works a 40-hour week, so he gets $800 a week in wages. Let's say he loses his job because of COVID-19. Under the North Carolina unemployment, he'll probably be able to get somewhere around $250 to $300 a week in unemployment. Well, now that the $600 is going to kick in from the federal government. So you add the two together, this employee is probably going to make $850, $900 a week in unemployment benefits. He will make more unemployed than he will working. Now, granted, this is a great benefit because a lot of these people need the money.
Sure.
But the other side, people are going to be arguing, well, this is kind of creating a welfare system is, you know, in a few weeks, a month or so, these people aren't going to want to come back to work because they're drawing so much unemployment. So stay tuned. You're going to hear a lot about this in the coming days.
Once you're in on the federal, will you be able to draw in the entire 4 months if you're unemployed?
Yes, from what the original bill was written. Again, I have no idea what's going to come out today.
Gotcha. You mentioned just one real quick one. I'm curious if looking in your crystal ball, you've got a forecast. You mentioned we've got 180,000 people here on unemployment. That's in the state of North Carolina?
That's right.
And do you have a forecast, or is anybody trying to anticipate what that ceiling might be before this is all over?
Nobody has any idea. Again, that 180,000 was just a 7-day period. Since the coronavirus outbreak of, you know, I don't know, maybe 2 weeks ago, 2.5 weeks ago, I think the total is about 250,000 in North Carolina that have signed up in total. And I will say this.
Yep.
I will say this. If you go back to 2008, the unemployment rate in North Carolina was somewhere around 9.5% there for, you know, a few months. I certainly think that we're going to probably exceed that level for a couple of month period.
Gotcha. Now, around the region, around the country, actually, there's a few companies that are actually hiring people. So, supply, something like Amazon. Where can people go to find out where there are available jobs to try to apply for?
Well, primarily, if you look on just the regular news sources, you know, on you know, whatever news source you may go to there. But like Amazon is going to be hiring 100,000 people. CBS is hiring 50,000 people. Harris Teeter is going to hire 5,000 people here in the area, et cetera. So a lot of this is going to be related to stocking shelves, getting product out to the consumers, et cetera. I would dare say they're going to be more on the line of blue collar type jobs rather than white collar jobs that are going to be coming open.
But they're great employers. I mean, these are really, really good companies.
Exactly right. And these people are having to up their pay rates, et cetera. So a lot of these jobs that, you know, a couple of years ago were paying maybe $10 an hour are now $15, $18 an hour jobs because of the demand for employees.
Gotcha. One last question for you, and take a little bit of time. I know we're getting close to the end of our time, but I think this is a very important area to talk about. On April 1st, and hopefully it's not an April Fool's on us that it actually is going to happen, but I believe there's a new sick leave law and for expanded families and medical leave act law. Are you familiar with it?
Yes, this could be a 20-minute conversation, but I'll condense it down to just a couple of minutes.
Okay.
It's called the Families First Coronavirus Response Act.
Wow.
And it covers all employers that have less than 500 employees. And it covers all governmental agencies, regardless of their size. It comes into effect on April 1st, and it's supposed to expire on December 31st. There are two parts to it. One is called the Emergency Paid Sick Leave Act, and people can draw 2 weeks of pay at full pay if they're out of work because they have been diagnosed with coronavirus or they're waiting treatment for coronavirus, etc. Another part of it is they can draw 2 weeks pay at 2/3 of their pay. In essence, if they're taking care of kids because the schools have closed, etc. Now, the second law that's going to come into effect in conjunction with this is called the Emergency Family Medical Leave Expansion Act.
Okay.
The regular old Family Medical Leave Act that's been around since 1993 covers employers with 50 or more employees, but this law covers, again, everybody with less than 500 employees. And it says that if you are out of work for child care reasons, again, your kid's school is closed, daycare center is closed, etc., you can be eligible for up to 12 weeks of protected leave and 10 weeks of paid leave at 2/3 of your salary. Now, the nice thing about it, these companies, and a lot of these companies that are having to go through this, they don't have a regular sick leave policy, so they'll be paying leave time you will get tax credits in subsequent quarters, and you will be reimbursed at 100% dollar for dollar for what you have paid out under this legislation.
Well, Kenny, appreciate the information. Guys, I tell you, when I started and we talked about putting this together, you know, this will be helpful a little bit for a few people. There'll be a few tidbits of information that can guide people that might be helpful. This has been unbelievably powerful, a wealth of information. Hopefully people that look at it, the beauty is that it will be available out on YouTube and other sources, social media. You can go back and review this. This is going to be a resource document. Mike, Elaine, I know Dena's gone. Kenny, you guys are a tremendous resource and a credit to our community. We're blessed to have you serve us and working with us and taking care of everybody. Bill, anything you'd like to say to wrap up?
Yeah, I'd just like to close. You know, as Kenny talked about the Civil Rights Act of 1964, I couldn't help but think of Dr. King in the midst of the civil rights struggle at a podium in Selma, Alabama. I'm going to paraphrase him. He said, "The measure of a man is not where he stands in times of comfort and convenience, but where he stands in times of challenge and controversy." And this is a very challenging time, and our government is handing down directives that are very controversial, whether that's local, county, state, or federal. But I want the people out there to know that the Lake Norman Chamber of Commerce stands with our membership. We're standing for our local business community, our restaurants who we are promoting on our website, the Shop at Lake Norman site on our website, the service businesses and essential businesses. Jeff, over the course of the last 2 or 3 days, I've had a lot of businesses call and say, "Am I an essential business?" And I would tell you, every business is an essential business. So we're out there working for you. We're going to continue to get information out to not only the businesses that are members, but all of our businesses in Lake Norman. But I want to thank our panelists. I want to thank the people who continue to support our business community. And I want to thank you, Jeff, for facilitating today.
Pleasure. Thanks, guys. Enjoy the weekend and stay at home.
Thanks for having us.
All right. Take care, guys.